Hi, everyone. We'll get started with our rounds today. They're a week early because of Easter next week, so thank you for making the time. Today we have Irene Boldt. She's an RN who works here at the health center. She has a clinical and research background in forensic mental health. She has a certification in psychiatric and mental health nursing and a PhD in nursing science. And bioethics from the University of Toronto. Her research interests include qualitative methodologies, critical ethics, particularly social justice and community reintegration and recovery within the forensic mental health system. She has worked for almost 10 years at the Centre for Addiction and Mental Health in Toronto as a point of care clinician, an advanced practice clinical leader, and a doctoral research fellow. She worked briefly at Lakeland before starting with us in May of last year. Welcome.
Hello, everybody. Thank you very much for attending Grand Rounds today here at the West Parry Sound Healthcare Center on this final day of March, this snowy day. Today, I'm going to talk to you about the Safe Justice Bed Initiative, and I'm going to talk about what it is and why it matters. And again, thank you very much for taking the time in your midday on this Friday to join us for this discussion. I'm going to see how timing goes, but I think I'm going to ask that everybody hold their questions until the end of the session. I suppose if you feel inclined, you can type your questions into chat while I'm speaking, but if you wouldn't mind just waiting until the end for discussion, that would be really fantastic. So please don't think that I'm ignoring you. I'm just hoping that we might have a more wholesome discussion at the end of the presentation. So let's get started. Let's see if we can make this work. There we go. So presentation details, as Kathy introduced, my name is Irene Boldt, and I'm a registered nurse, and I'm a nurse navigator and clinical lead here at the West Parry Sound Healthcare Center. And my email address, if you ever want to reach out or have any questions, there it is for you. And just to let you know that I have nothing to disclose in terms of making this presentation to you here today. So the objectives of this presentation, at the end of this presentation, I hope that you will have a better understanding of what the West Parry Sound Healthcare Center Safe Justice Bed Initiative is. It's my hope that you will have a better sense of who it serves, how it works, and what its intended outcomes are, and also a little bit about what its philosophical underpinnings are and its moral significance, and also why it is of value to the Parry Sound community. So I know that Kathy already went over a lot of this, so I'm just going to do a sort of quick overview. I have been a registered nurse since 2010. I have a special certification in psychiatric and mental health nursing from the Canadian Nurses Association. I have a master's degree in nursing from Ryerson University that I got in 2015. And immediately following the completion of that degree, I started my PhD work at the University of Toronto, and I, in 2021, finished my PhD in nursing science and in bioethics. And in the context of both of those degrees, I did some research, and I used qualitative methodologies, specifically critical ethics, and then in my doctoral work, particularly with a focus on social justice. And I focused on community reintegration and recovery in the forensic mental health system. And so a lot of my clinical background is working with people who have severe and persistent mental health issues and have been convicted of committing a criminal offense, but have been found not criminally responsible for those offenses and have been treated in hospital from a rehabilitative care point of view, as opposed to in the criminal justice system. And I'm going to talk a little bit more about that as we move into the presentation. My clinical experience, I started working at the Centre for Addiction and Mental Health in Toronto, immediately finishing nursing school, and I worked in medium security forensics, so on a locked, secure forensics unit, again, with people with severe and persistent mental health issues and criminal justice involvement. When I was working, when I was doing my master's degree, I worked in our ECT department, again, at CAMH. And then when I was doing my doctoral work, I returned to working in forensics, and I worked as an advanced practice clinical leader and also as a doctoral research fellow. When I finished my PhD in 2021, I found myself living in McTier, Ontario, just a little bit south of here. And so when I wanted to step back into clinical work, I started working at Lakeland, and I worked there from September 21 until April of 2022, so last April, a year ago. When I had the opportunity to come and work at the West Parry Sound Healthcare Center. And I have been in the role that I have now, clinical lead nurse navigator and responsible for the Safe Justice Bed starting May of last year. So let's explore the Safe Justice Bed Initiative, what it is. So this is the first part of my presentation. So an overview of what the Safe Justice Bed Initiative is. The Safe Justice Bed Initiative is a short-term inpatient stay for individuals who are justice involved or at risk for justice involvement. And so part of the reason that I just wanted to speak a little bit about my clinical background is because of the fact that I've been working in forensics for most of my career, and that I did my research in forensics, both in my master's degree and in my PhD. The idea of developing an initiative and supporting care for people in the Parry Sound community who are either justice involved or at risk for justice involvement and have mental health issues seemed a really suitable role for the kind of person that I had been in my career up until now. And the intention of the Safe Justice Bed Initiative is to support patients in crisis resolution, to promote their effective community reintegration, to increase their community tenure, and to minimize their involvement with the police. So that's the intentions of this initiative. So who is involved in this initiative? So we've talked a little bit about me, and I am the person who is here and responding most clinically to the people who are in the Safe Justice Bed Initiative, but I work very closely with my colleague, Katrina Aguiar, who is on this call today. She is a mental health and addictions worker, and she has a bit of a hybrid role. She works here in the hospital very closely with me and supporting the person who's in the Safe Justice Bed. But she also has a role working with the District of Social Services in the community. And so given that the intention of the Safe Justice Bed is to support people in crisis resolution and with their residents in the community, having her work in this initiative is really important in terms of supporting people who have landed in the Safe Justice Bed Initiative, but are looking to, at the end of that 30 days, move back into the community in a place that is more stable than the place from which they came into the bed. And then the third person who's involved in this initiative is Kara Rankin, who is also on this call today. And Kara has been at the hospital for a long time. She is at least known to me as the manager of the emergency department mostly, but she is also the manager of the Safe Justice Bed Initiative. The hours of operation for the Safe Justice Bed Initiative are the hours that I am here on site at the hospital. So that's Monday to Friday from 7:30 until 3:30. And methods of contact, that's my extension here at the hospital, 3125, if you ever want to call. If you need to have the fax, there it is. And again, my email address and Katrina's email address. So if you ever have any questions or want to discuss the initiative or possible admission to the initiative, you may reach out and contact us in any of those ways. So I want to talk a little bit about program development. So that started in May when I started here at the hospital, and we took about 6 weeks to develop the Safe Justice Bed Initiative before we had our first patient come into the bed. And so in developing the program, we first needed to figure out what the goals of the program were going to be. So the goals of care, the primary goal is crisis mitigation via a short-term residential accommodation. So short-term, 30 days, people are invited into the Safe Justice Bed Initiative. And just to be clear, that is an inpatient admission here at the West Parry Sound Healthcare Center. And the intention of this initiative is to divert individuals who are in mental health crisis from frequent and regular contact with our emergency department and or our police and or courts system. And so ideally we want to divert people who are in crisis from these kinds of interactions. And we're also looking for outcomes, for example, fewer people being charged with low-level, low-risk criminal offenses. We're also hoping that more people in the Parry Sound community will be connected with supports that enhance their well-being and prolong their community tenure. We're hoping to have more people in the Parry Sound community identified, referred to, and engaged with the Parry Sound Rapid Access Addictions Medicine Clinic, or our RAM clinic. And we want over time to have, in an ideal situation, more people in the Parry Sound community reporting an improved mental health function and mental health outcomes within our community. So lofty goals, but this is one step that we can take towards working towards those goals. And the care philosophy that guided the development of this program: patients in the Safe Justice Bed Initiative are going to be, or are being provided, psychosocial rehabilitation care that is patient-centered, recovery-oriented, trauma-sensitive, and based on the principles of harm reduction. And so this is beginning to sort of speak to a little bit about why this Safe Justice Bed Initiative is important, which I will speak to a little bit more as we get further into this presentation. So continuing with program development, who does the Safe Justice Bed Initiative serve? So the Safe Justice Bed serves people who are in frequent and or immediate contact with the police. Patients in the Safe Justice Bed are in a mental health or addictions crisis. They are also medically stable and not at risk to themselves or others. Therefore, the patients who are those who are suitable for invitation into the Safe Justice Bed are by definition not suitable for a typical hospital admission as deemed by our medical professionals. They're not appropriate for arrest or detention by the police, but they are in crisis and they are in need of a supportive short-term mental health place where they can begin to work on that crisis mitigation piece that I was speaking to earlier. So who does the initiative serve? The basic eligibility criteria for admission into the Safe Justice Bed Initiative: patients need to have a valid OHIP card. They need to be a member of the Parry Sound community or the surrounding community. We're looking at working with people who are 18 years of age and older. We haven't yet had the invitation to consider a person who is 16 years of age and older, but we would, in special circumstances, make the bed available to a person who was between the ages of 16 and 18. People need to be affected by a mental illness or a mental health problem and or have substance use and addictions issues. Although I think it's important to note that a diagnosis is not required to meet the basic eligibility criteria for consideration for admission to the Safe Justice Bed. People need to be in crisis. They need to be either already involved with the criminal justice system or at risk for involvement with the criminal justice system. They need to be likely to benefit from having increased supports. They need to be able to be safely supported in the community upon discharge. And so there needs to be, that speaks to sort of the risk and medical situation that people find themselves in. If people are not able to be supported in the community upon discharge, they're probably not likely suitable for admission, but that is something to consider when we are admitting people. And then to meet basic eligibility criteria, people need to be willing to consent to be referred to the initiative, because the initiative itself is a voluntary opportunity for people. So diagrams are complicated and a little bit hard to speak to, so I'm going to do my best with this. So at the top part of this Safe Justice, of this diagram is the Safe Justice Bed Initiative, and this is about program development. So this is thinking about how the Safe Justice Bed Initiative is supporting the health and wellness of people in the Parry Sound community, and specifically supporting their wellness and their community tenure. So although the Safe Justice Bed Initiative is an inpatient hospital admission, the idea is that we're looking to use this initiative to support people in their life in the Parry Sound community. And so the Safe Justice Bed is supported by the mental health hub here at the West Parry Sound Healthcare Center. And so I've already alluded to Katrina's role working for the District of Social Services, and she also works in the mental health hub. And so when she is here supporting the person in the Safe Justice Bed Initiative, there is representation here in the mental health hub from the District of Social Services in Parry Sound. And I think that that's important to begin to understand how the mental health hub itself as a part of the hospital is supporting people who are both in hospital and also in the community and in that transition of needing support in the community. We also have in the mental health hub the Rapid Addictions Medicine Clinic, and so that clinic is run Mondays and Thursdays from the hospital. So people come into the community to meet with the nurse practitioners that run the RAM clinic, but it also gives an opportunity for people in the safe justice bed to have immediate access to addictions medicine support and to begin to develop rapport both with the District of Social Services and the supports that organization can offer, but also RAM clinic. And so the mental health hub working to support people who are in the community, but also people who are in the Safe Justice Bed Initiative. And that's something new in the West Parry Sound Healthcare Center. And so I think it's lovely to acknowledge what we are doing to support the mental health of people in the Parry Sound community, and that the Safe Justice Bed is only just one piece of how that's beginning to come together in our community. So again, that idea of speaking into why the Safe Justice Bed Initiative is important. And then also you can see in this diagram that there's a tiny little corner of the West Parry Sound Healthcare Hub that sits over the community mental health. And I think that's important because there is the semi-permeable barrier of the mental health hub, which means that the community mental health does come in to support Safe Justice Bed Initiative, but also that they are able to be present in the mental health hub, and that they do sometimes find themselves working here, and they provide invaluable support to the mental health hub and also specifically to the person who's in the Safe Justice Bed Initiative. And then just to complete that sense of community, so to look at all of the people that are the primary organizations in our community that are involved with what we're doing here in the Safe Justice Bed Initiative. And I just want to acknowledge that this diagram by no means is complete. There's lots of stakeholders in the community that are not represented in this diagram, but this is just a simple overview of how the Safe Justice Bed, as you can see, it's sort of distinct now that we've got the community supports and the mental health hub supports, that the Safe Justice Bed as a hospital inpatient initiative is both distinct and connected to the mental health hub and the community. And I think that that's a really important wraparound piece, this integrated approach that we are starting to take here in the community to support people who are in mental health crisis and involved or at risk for involvement with criminal justice. And that's, of course, why the OPP are included on this diagram, because they play an important role in making sure that this whole system works in an integrated fashion. So program implementation, we started the program in June of 2022. So how people, and obviously this initiative is continuing into today, so how people are referred to the Safe Justice Bed Initiative, any agency or person can make a referral for any individual who meets the basic eligibility criteria. And access to our referral form, please don't hesitate to reach out to me or reach out to Katrina or initiate contact with me by phone or email, and I'd be more than happy to send a copy of our referral out to you. So referral process, you can send a copy of a completed referral to the mental health hub via the fax number. You can, as I said, just reach out to me, send me an email, or leave me a voicemail. Any way that you want to connect, if you have a person who meets basic eligibility criteria and you think is suitable for the Safe Justice Bed Initiative, that's how the referral process works. And then once a referral is received and or completed, intake interviews with the patients are conducted usually within 24 to 72 hours after the receipt of referral. So we're looking very quickly to connect with the people who are coming or potentially coming into the initiative. So program acceptance, how do we decide? This is really challenging when we have more than one person who's interested in coming into the bed at the same time. And so it's a team decision. I meet with Katrina and Kara, and we make a decision based on the need, the level of urgency, and the likelihood of benefit of the person who's being referred. And, you know, those are hard decisions to make given that there's only one bed. But it is, I think, important that we have a process so that we can make decisions about who will be the person who is invited into the bed. Admissions pathways. So we've had 2 different ways that people have come into the bed so far. So people who are accepted into the program but are not currently in hospital are invited to come into the emergency department and request admission to the safe justice bed. And that's usually a scheduled situation. And so in that time, I have the opportunity to go and meet with the emergency room team so that they are aware of the fact that the person is coming in and supportive of that admission. And then the other way that people can be admitted into the safe justice bed is that if they are already in hospital, but they were admitted for medical reasons, and then they're referred and accepted into the safe justice bed, they can be admitted directly into the safe justice bed following the resolution of their medical issues. And I think it's just important to note that admissions into the safe justice bed, because it is an inpatient hospital stay, are at the discretion of either the emergency room physician or the hospitalist in hospital. So looking at what we have done so far in the program, we have had referrals for 11 patients. We have had 8 distinct admissions into the safe justice bed. We've had 6 individuals and we've had 2 people come into the bed twice. We've offered, based on having received a referral, to 5 people who have declined admission. And we have 2 people who are in queue and may come into the bed next time the bed becomes available. In terms of looking at referral sources, so where did those 11 referrals come from? We've had 1 referral from District of Social Services. We've had 1 referral from Community Mental Health. We've had 6 referrals from the West Parry Sound Healthcare Center, either from people who are in hospital already or for people who are coming into the emergency department frequently and often coming in with OPP. And then we've had 3 people referred following being presented at the situation table in Parry Sound. And I think it's interesting to just notice why those 5 people who declined admission declined. So in part, there is some discomfort with the idea of being invited into the hospital. So there's a block with the inpatient setting. And specifically, people have expressed concerns about the fact that they will lose some of their autonomy. And also, I think that that's a fair perception, because there is actually a little bit of loss of autonomy, especially in the context of having an inpatient setting happening in the context of the COVID pandemic, which has meant that people do have less mobility between the inpatient setting and the community than I think a lot of people would like to have. And so some people have said no for those reasons. And also people consent to be referred, and then in the discussions that we have about what being in the safe justice bed initiative would actually look like, realize that they're not actually interested in setting and working for treatment goals, and or the idea of being abstinent from substances is something that they're not willing to be working towards at that time. And so they, learning more about the Safe Justice Bed Initiative, then decline. So looking at how long people, so this is just the people who've been in the Safe Justice Bed Initiative. So those are 8 people, or sorry, 6 people, but in for 8 separate admissions. So we've had 1 person who came in just briefly and then decided that they didn't want to be in the Safe Justice Bed and so left. We've had 4 people who've come in for that ideal length of stay that's as long as a few weeks, but not longer than just over a month. And then we've had 3 people who've come into the bed and have stayed in excess of 60 days. And I think that that's important just to notice how difficult it is to safely discharge people back into the community. And so there's a commitment that we are showing here at the West Parry Sound Healthcare Center to support people in a safe discharge. And I think that again also speaks to why the Safe Justice Bed Initiative is important. There's clearly a need to give people the opportunity to support when they are in mental health crisis. And so sometimes that means that the 30 days is not quite long enough to get a plan in place that can adequately support their needs when they are discharged from hospital. In terms of demographics, so now again, we're looking at the full, all the people who've been referred. We've had 9 male people referred and 2 females. We've had 5 Indigenous individuals, 5 white individuals, and 1 Black person. In terms of who's been referred, the youngest person referred so far is an 18-year-old, and the oldest person is 59, with the average age being just under 40. And in terms of bed designation, so once the person is admitted into the Safe Justice Bed Initiative, they are most often initially admitted in an acute care bed designation. And then once the team in hospital becomes familiar with people, then they're often transitioned into an alternative level of care bed designation. And that's most of the time for most of the people in the initiative, they are here under an ALC bed designation. So continuing with program implementation. So what services are we offering these people when they come into the Safe Justice Bed? So primarily the goal is stabilization of their acute mental health crisis. So we offer people an inpatient admission lasting as long as needed, given our numbers, but ideally we're looking at that 1 to 30 days admission. While they are here to support that stabilization, they have regular contact with me and or with Katrina, and both of us have specialized training in supporting people who are in mental health and addictions crisis. They also have daily contact with members of the West Parry Sound healthcare team. And I just want to take pause as I'm talking more about the services that we offer, that Katrina and I can only do so much. What is really wonderful about having this Safe Justice Bed Initiative in our community be something that we offer in hospital is that people in the Safe Justice Bed Initiative have the opportunity to be supported by the full scope of what we can offer here at the West Parry Sound Healthcare Center. So they get support from all members of the team. And I just want to acknowledge that everybody here at the healthcare center makes a valuable contribution to the experience that people in the Safe Justice Bed Initiative are having. So another important aspect of what we're offering people who come into the Safe Justice Bed Initiative is this idea of respite. So stepping away from being in crisis and having an opportunity to take stock of what your situation is. And so we are providing people with a safe therapeutic environment where they can begin to figure out how they might renegotiate their situation in the community, and that they are going to get some comprehensive support in so doing. So we start with assessments. So there's a frequent and ongoing assessment of both their mental health and their physical health needs. And one way that we execute that in the context of the Safe Justice Bed Initiative is by completing a GAINS assessment, a global appraisal of individual needs. And this is a really useful tool. So I think almost everybody who's come into the Safe Justice Bed has had a GAINS assessment done. And this speaks to the really important integrated approach that the Safe Justice Bed Initiative offers. So GAINS assessments are completed most often by community mental health. And so that begins to establish those linkages for people who are in the bed with community organizations. And it also gives us an opportunity to support using the results of the GAINS assessment to develop plans of care and treatment goals for people who are in the bed so that we know what their needs are as they're planning discharge. So while they're here, they get care that addresses their biopsychosocial needs, and that depends on what the patient needs. Every patient has been really different. So medication management, we look after their healthcare needs. So diabetes management, wound care, nutritional counseling, diagnostic testing, vaccinations if needed. We also sort of take a bigger perspective approach. So looking at health and wellness overall. So support with health teaching, including education around mental health and addictions, early recovery, assistance with the full scope of their activities of daily living. And that can include being supported, moving back into the community. So having some company going to figure out how to address the things that you need to be looking after to support yourself when you're in the community. We also offer short-term and or targeted counseling specifically to address whatever that particular individual's needs are. And that can also include some substance use and addiction support. So as I mentioned, education, also some with support with their non-complex withdrawals. So oftentimes they're coming into the Safe Justice Bed Initiative immediately stopping using substances. And so helping people transition from using to not using. And that's a really great reason why it's nice to have rapid addictions medicine in the mental health hub and connect people who are in the Safe Justice Bed Initiative immediately when they come into the bed with the kinds of supports that will continue to support them in the community upon their discharge. Comprehensive discharge planning, that's something that starts almost immediately upon their admission because 30 days is a short period of time. And so it takes time to make the appropriate referrals and linkages for people into the community supports and services. So what we're looking for is using again the results of the GAINS assessment, figuring out whether it's residential addictions, concurrent disorders, addictions treatment, community-based counseling, therapy, linking up with community mental health. People often need support with housing and other social services, finances, Ontario Works, Ontario Disability, and also providing that criminal justice piece. So linking people up with lawyers or legal aid or anything that they might need to support their criminal justice engagement. And then we are open to and considering the possibility of a graduated discharge. And when we were first contemplating what the Safe Justice Bed Initiative was, when we were talking about graduated discharge, I think we had an idea of the fact that the person would stay in hospital and the graduated discharge would be long leaves of absence where people could begin to explore what it would be like to live in the community, but have the option of coming back into the Safe Justice Bed in the hospital. But what we've learned in terms of when we've actually been running the program is that the graduated discharge is not necessarily a graduated discharge from the hospital itself, but it's a graduated discharge from the Safe Justice Bed Initiative. So for example, we had a person who came to the end of the 30-day stay, and it was going to be quite a long time before that person could transition into residential addictions treatment, which we had secured for them. But so the graduated discharge then looked like the person was housed in the Parry Sound community, but was continuing to receive very comprehensive support from me and Katrina and from the other community organizations, so that that person was still very much part of the Safe Justice Bed Initiative, but was no longer in a hospital bed. And so the graduated discharge, I think, is more a graduated discharge from the Safe Justice Bed Initiative itself. It doesn't necessarily mean that the person is continuing to remain in hospital. And then finally, what we're offering for people is advocacy. Explaining the utility, the importance of the Safe Justice Bed Initiative and what its need is, and justifying why it is that we as a community have chosen to go in this route to support these people, I think is an important part of what we're doing here in the Safe Justice Bed Initiative. And so, for example, this presentation is one of those things where we are providing service for people who come into the bed by justifying why this work is so important to all the people in the community. And I'm very grateful for the diversity of our audienceship in this particular situation for this particular presentation. So that's what I'm speaking to when I think about what we're offering in terms of services and having advocacy be one of those things. So discharge destinations, where have the people who have come into the Safe Justice Bed, what has happened? So we have had 2 people discharged into housing. One person returned to their own home and one person was discharged into a new community, into housing in that new community. And then we had one person who discharged into what I have referred to in this context as bridge housing. And so that's that idea of supporting people in the community, but who are still very much in the Safe Justice Bed Initiative while they are waiting to go to the next phase of whatever it is that they have decided is best for them in terms of their recovery. So in this case, it was residential addictions treatment. We've also had 2 people leave the Safe Justice Bed Initiative directly into residential treatment. And then we've had 3 people choose to leave the Safe Justice Bed Initiative voluntarily. And unfortunately, those individuals were discharged into a state of homelessness, which is, I think, an important acknowledgement of the reality of what's happening here in our community. Housing is a big problem and a big influencing factor on the level of crisis that we're seeing when people are coming into hospital. So that's another reason why it's really fantastic that the Safe Justice Bed itself is such an integrated approach to providing care and support for people who are in crisis. So here's the slide where I was hoping we would have time for questions, but I'm again going to ask you just to park your questions and we'll get to them in a minute. So let's talk about a little bit more focused on why the Safe Justice Bed Initiative here at the hospital is important. Why does it matter? So in this portion of the presentation, I want to just talk a little bit about what safe means, what justice means, and how these ideas are understood in the context of biomedical ethics, and then how this whole idea is related to criminal justice and social justice. And then the sources for this portion of my presentation are from Beauchamp and Childress's Principles of Biomedical Ethics. And you can see that these people have been working on supporting principles of biomedical ethics for 40 years. And so they are foundational, I think, maybe to a lot of people's understanding of biomedical ethics. And then Powers and Fadden's Ideas on Social Justice, that's the framework that I used in my doctoral work. So it just happens to be a social justice framework that I'm quite comfortable with, and it's suitable to talk about this initiative. So let's see how that part of this conversation goes. So biomedical ethics, safe, what does it mean? So, and I'm focused on the word safe and justice because this is the Safe Justice Bed Initiative. So safe. Safety itself is not a biomedical ethical principle, but it is closely related to one of the 4 principles, which is non-malfeasance, and that's the obligation not to do harm to patients. And so providing safety, which is what we are offering in the context of the Safe Justice Bed Initiative, is an enactment of this principle of non-malfeasance. And so we are taking actions that address our obligations both as healthcare providers and also as a healthcare organization to ensure patients are not exposed to unnecessary risks of harm and to take appropriate steps to minimize the risk of harms when harms are necessary. And so the idea that the Safe Justice Bed gives people an opportunity to step away from socially mitigated crisis in the community and take some respite is an important ethical principle that we are enacting by having the Safe Justice Bed be something that's happening in our community. And then looking at justice, so from a biomedical ethics point of view, what is justice and why is it important? So justice, the principle of justice. So justice, unlike safety, justice is a biomedical principle. And it is concerned with the fair and equitable distribution of benefits, risks, and costs. And so justice is important because it speaks to our obligation to support people in ensuring that everyone has equal access to the healthcare resources in our community, regardless of their social and/or economic status. And the principle of justice also speaks to the idea of the fair and equitable allocation of scarce resources, the provision of healthcare to vulnerable populations, and our obligation, again, as healthcare providers and as a healthcare organization to address social inequities that impact the health and well-being of our patients and our community. And so the Safe Justice Bed Initiative enacts this principle of justice. We are taking actions that are supporting an allocation of resources in ways that allow us to care for all members of the Parry Sound community. And I think it's just interesting to acknowledge that we didn't have a Safe Justice Bed Initiative until recently, and now we do. And so that in and of itself is an indication that we have taken steps to reallocate some resources. There is a bed in this hospital. We didn't create a bed. We are borrowing, taking a bed that was already here, and we have now allocated that bed to support the principle of justice, this idea of equal access and addressing some of the social inequities that impact health and well-being of our community members. So a little bit more about this part of the discussion. So the Safe Justice Bed Initiative matters because safe justice is an opportunity for rehabilitation over punishment. So the idea that safe justice is not criminal justice. So minimizing people's interactions with criminal justice system is bringing people into the Safe Justice Bed Initiative and giving them the opportunity to take a rehabilitative approach to their situation that is not punishment and not punitive. And then sort of from a bigger picture point of view, looking at what safe justice is and why it's important. When you come into the Safe Justice Bed Initiative, there is this foundational approach to accepting people and understanding where they are in their social situation without judgment, and then inviting them to engage in a way that will be restorative to where they are and what they're doing, that is invitational and not enforced. And that we are going to focus on what the patient's perspective is and what the patient's needs are, not what our views of what we might want to be doing to and with or for them. So that idea of being the care that we are offering in the Safe Justice Bed is collaborative. It's something we are doing with the patient, not doing to the patient. And I think that's important just from this final point on this slide, a respite before treatment. So we are giving a place that is invitational, voluntary, accepting, and a pause before we help and offer treatment. Treatment is something that healthcare providers offer to patients. And so the idea is that we want to give people the opportunity to be in a place where they can accept the treatment that is what they are hoping to accomplish from their point of view. And so that we can support offering treatment once people have had the opportunity to land in a safe therapeutic space. So this idea of switching our focus in this community from a sort of and dependence, right? It's not a judgment. It's just what we were doing before was criminal justice was our best approach. And now we have a different approach, which is the safe justice approach. And this matters, this creation of the Safe Justice Bed Initiative matters because it allows us to support vulnerable individuals and take their vulnerability to criminal justice involvement and give them an alternative. And so the Safe Justice Bed Initiative supports an approach to care that is voluntary and non-punitive, patient-centered, recovery-oriented, trauma-sensitive, and based on the principles of harm reduction. And so if you recall when I spoke at the very beginning of this presentation about what our care philosophy was, this is the full circle. So questions about why the Safe Justice Bed Initiative matters is because it gives us a different way to approach justice that is responsive to what the patient's needs in a way that is supportive and not punitive. And then finally, just linking this idea of safe justice to social justice. So it's my conjecture that the Safe Justice Bed Initiative matters because safe justice is social justice. And so just a quick sort of look at what social justice is. So social justice means ensuring that everyone has access to enough of the primary goods to live a decent life. And that understanding what it means to be living a decent life is to think about what it means to have a sufficiency of well-being. And in the context of Powers and Fadden's conception of social justice, well-being means having a sufficiency of health, personal security, opportunities for reasoning, social respect, attachment, and self-determination. And so looking at that in the context of the Safe Justice Bed, so immediately we are inviting people to come into hospital and there is a focus on promoting their physical and mental wellness. Also this idea of safe, so right in this conception of social justice is this idea of safe justice and the importance of personal security. So having safety, having protection, and having an opportunity to be in a safe place that is safe physically and psychologically and also socially and relationally, which is what we are offering to people here in the Safe Justice Bed, which is why I want to give credit to the full scope of care providers who are supporting people both in hospital and in the community, but supporting people who are in this initiative and then receiving people when they're discharged from the hospital back into the community, that we can cultivate that attitude of safety and protection that is very comprehensive. And then this idea of reasoning as being a fundamental aspect of social justice. And so this invitation for people to be engaged in their own situation and giving them the opportunity to have and make a valuable contribution to what is happening for them, which means that they need to think about themselves in their situation and then be invited with support about making decisions for themselves. So really using their cognitive resources, their reasoning capacities to figure out what works for them and what's important. And then this notion of respect. So the Safe Justice Bed Initiative is a show of respect, and it cultivates that feeling of respect, both at an individual relational level, but also from a social point of view. The fact that we have that in this community says something about what we are doing here at a community level that's more than just respect of one to another. And the other thing I think that's really important about thinking about respect in the context of social justice in this context is the idea of people learning to respect themselves. And so when they receive respect from society, from community, and from healthcare providers, there's an opportunity for them to start to nurture self-respect, which can be, for some people, a real challenge. Also, this idea of the importance of attachments, of cultivating strong supportive relationships. And then in the context of what we are doing and what I was talking about in the rehabilitation sort of non-punishment discussion is attachments that are non-authoritarian and non-patriarchal. So we're looking to level the playing field and have people engaged in a meaningful way that is equitable. And so that it's not a top-down done to, it's a collaborative done with idea. And then the final piece of social justice, as per Powers and Fadden's theory, is this real focus on the importance of voluntary engagement and having the capacity to function as an autonomous person and having voice and being heard. So that is that idea of the safe justice bed and what happens to people when they're in the safe justice bed being really led by what patients need and want for themselves. So in conclusion, I think that the safe justice bed matters because the safe justice bed initiative is social justice enacted. It acknowledges, so what the safe justice bed initiative does is it acknowledges social injustices. It prioritizes the health and safety of people, and it seeks to comprehensively address all the aspects of patients' well-being when they're here in the bed. Okay, thank you everybody for attending. And now I will open it up to questions, discussions, thoughts, ideas.
If anyone has any questions, just go ahead and unmute yourselves.
Yeah, that would be my preference, actually. I'm not so good at talking and reading, and nobody's put anything into the chat anyway, so.
No, but Katie was giving you a good hand of applause, so.
Thank you.
Irene, thank you so much. That's a wonderful presentation. And I just want to thank Katrina and Irene for the incredible work they've done to get this program up and running and the wonderful things that we've seen accomplished through it. So thank you so much.
Kara, thank you. I mean, it's a team approach, and I feel really lucky to be able to be supporting the Parry Sound community in this, and I'm so grateful to have you and Katrina and everybody else who's involved participating. It's been really, really lovely. Hello, sir. Your name says Susan, but I think that's Susan?
Yeah, this is Susan Hayter here. I'm one of the directors of the board.
Hi, Susan.
I'm sitting in my tax office surrounded by numbers. And I have to tell you that my reaction, I am close to tears. First of all, I just applaud your passion about this. But I think the thing that is coming to me is the idea of kindness and respect for an individual, and that idea of respite, the idea of just being able to take a breath and not just step out of the spiral of things that have been happening. So if that's what you're trying to achieve, just bless you for doing that. So, okay.
Thank you.
So
I appreciate that comment, Susan. Thank you.
Yeah.
Debbie?
Thank you. Irene, I wanted to congratulate you on this initiative. I think it's a real game changer. And I should mention that I'm also a board member and appreciate the opportunity to participate today. I did have one thought. I noticed that the representation of Indigenous peoples in this program is roughly 50%. And I wondered, I know that when you think of the concept of safety, we can also expand that to mean cultural safety as well. And I just wondered, what elements of cultural safety do you employ for those individuals? And secondly, are you able to, I guess, seek out and employ any Indigenous services or agencies when, thinking of the discharge process and having these folks transition back into their communities or their regular lives? So yeah, those are things that occurred to me.
Debbie, thank you so much for that question. I really appreciate you bringing that up, actually, because I didn't have a slide to speak to it, but I did want to just acknowledge the fact that I think in this presentation in general, there was maybe not the attention and focus on the Indigenous piece. And I think that is, you're right, with 50% representation in our numbers, something that needs to be spoken into and needs to be acknowledged and addressed. And so I'm so grateful to you for bringing that up. And it's my own apprehension, caution, concern that I have to admit, I wasn't entirely sure how to be sensitive to that particular issue in this kind of context. But just to identify your concerns and to speak into some of them, we have engaged a number of Indigenous specific services for the people who have been in the bed, and also with community service providers who have those specific skills and who are able to support us from that cultural safety point of view. And so some of the discharge destinations and the community supports that people have received when they've been in the Safe Justice Bed Initiative have been very much in response to their wanting to engage with Indigenous specific services, and that we have, based on each person's individual needs, aligned the care we are providing in a way that is culturally safe and culturally sensitive.
Thank you. That's amazing.
Yeah, and thank you. And that's a work in progress, that in terms of that sensitivity. And so thank you for bringing that up. George, you've had your hand up for a long time. I can't hear you. You're on mute.
How about now? Can you hear me now?
Yes.
I wanted to just ask what would be when we're discharging, do we need more residential facility for treatment, or is it more just general housing stock, or what exactly is needed for the residential component?
I think that's a really interesting question. So well, we need both, actually, is the actual answer. So the real challenge is that a lot of the people who come into the Safe Justice Bed do have significant addictions and or substance use issues, and so would really very much benefit from and are willing to acknowledge that they would benefit from a residential addictions treatment opportunity. However, the timelines to admit or have a person admitted into those in our province are in excess of the 30 days that we can keep people in the Safe Justice Bed. And so the real challenge is that idea of how we give people that respite and pause and a care plan to set themselves up for being more well situated in their own circumstance, but they do need that addictions piece in the longer term. But in the meantime, we are struggling to have supportive, adequate housing locally so that they don't need to be in hospital, but they aren't yet ready to go into a residential treatment facility because they haven't been invited into that opportunity yet. And so that's what I was talking about, that bridge housing. That's a really, really challenging piece in this community because of the fact that we are in a housing crisis. And so there isn't that kind of residential opportunity that would be so valuable. And then for those people who are in the Safe Justice Bed, but who are either not interested in residential addictions treatment, or that's not a suitable long-term goal for them, they still do really struggle. I mean, a crisis in housing is one of the things that perpetuates crisis and makes people suitable for admissions to the Safe Justice Bed. And so there is a real challenge in that regard, just from a basic resources point of view. That's something that we don't have access to, especially affordable housing in this community. Does that answer your question, George?
It does for sure. Thank you.
Okay, you're welcome. Hi, Katie.
Hi, I just wanted to comment, Debbie, thanks for bringing that Indigenous question forward from an organizational perspective. I thought I'd offer some comment on that. So first, I want to say to Irene, I had very similar reaction to Susan, and I've been intimately part of this program. And it really makes me so proud, the work that the entire team is doing. I had the privilege to work at the Rapid Access Addiction Medicine program yesterday as an NP and be involved with a client who's involved with this program. And every time I get to speak with a patient that has been involved in this program, it really is evident as to why this is so important. I've been at provincial tables where people are wondering how we do it. And we do it because of the integration between DSAP and the NPLC and the hospital. It's just such an integrated, intertwined program. From the Indigenous perspective, Connie Foster, the Rapid Access Addiction Medicine nurse practitioner lead, she is really spearheading the development of our crystal clear policy for the entire organization, and it is being reached across the province. People are very interested in adopting a policy around stigma, anti-racism, but also around cultural safety and sensitivity and education for all healthcare organizations. So we're really excited to be part of this this initiative, and that will also that will involve all of our programs. So not just the Safe Justice Bed, but across all of our programs at the health center, the NPLCs, and then leading into provincial strategies. So really excited about what we're seeing in terms of that Indigenous component. I also, I'm not sure if Connie's here. I don't see her, but she's been involved with the development of a residential treatment center in one of the First Nation communities. And so we're intimately involved with some of the things that are happening in the community through Connie's relationships, through our relationship with CMHA and Masani Mamajuan. So I think that we'll see a lot more change and a lot more of that cultural integration in all of our programs, but throughout the community.
Yeah, thank you, Katie. I think there's lots to be looked forward to, and this is just a start. I mean, this is what we've, in terms of the mental health hub and the Safe Justice Bed initiative, and this is what we've been able to accomplish in 11 months. And so I just feel like there's real energy and real direction and real momentum in a way that is, and like I said, the diversity of people who are on this call, I mean, there's such a willingness to step forward into a space that's so much more positive. And I think that's just, it's so uplifting for me. And I think for everybody, I think there's a lot of really good, positive, optimistic energy here. Does anybody else have any questions or thoughts?
I don't really have a question, Irene. I just wanted to say thank you for the presentation. Like, it was phenomenal. I mean, I know what you've done because I've worked directly with you with select patients that you've had, but like in general, your knowledge is just, it blows my mind every time. And this is just such a bigger impact of how much more knowledge you actually have that I was like not aware of, kind of thing. But it's just, I think with every patient that you work with, what I've noticed is you bring that knowledge, but you also bring your own personhood to it, which I find phenomenal. And it's just, you always make it with the person, which is awesome. So I just wanted to say thank you for that.
Megan, thank you so much. I think I've learned a lot coming to work in Parry Sound, and I feel really blessed to be in a community of practitioners and care providers who all reflect the things that you just said, yourself included. And I think it's just, that's what I was speaking to about that positive energy. It's just, it feels really great to be working in a place where everybody is willing to bring themselves and their best skills as clinicians and care providers and community involved, interested people to a situation, because I think that there's real opportunity for real fantastic growth moving forward. So thank you, Megan. That was really nice.
I don't know if you've noticed, but there's a couple of comments in the chat box, Irene.
Thank you, thank you, thank you. I see Donald and Jim. Thank you very much for your comments.
Any other questions, comments? Not seeing any. Thank you so much, Irene. That was fantastic. It was nice to have so many people participate and learn about this new initiative. Just as an FYI, our next rounds will be April 21st, and they're with Dr. Richard Kim, who will be speaking about personalized medicine. So something a little different. Thank you once again, Irene.
Thank you. Thank you, everybody, for hearing me through and learning about the initiative. If you ever have any questions, please don't hesitate to reach out. Yes, Debbie?
Thank you.
Oh, no, I'm just clapping.
Oh, okay, that's a clap, not a hand wave. I'm sorry.
Yeah.
Okay, I appreciate that. Thank you, guys. It's
Yeah.
really, really nice.
Okay.
I appreciate
Thank
your
you so
time.
much.
Thank you.
Bye.